Warm greeting to respected judges and all the delegates present here. We are presenting a poster named Socket Shield Technique, a new approach to aesthetic rehabilitation. The socket shield technique was given by Husler in 2010. This technique is also known as the partial extraction therapy, the root membrane technique, and the partial root retention. The basic aim of this technique is the preservation of the buccal two-thirds of the root in the socket so that the periodontium along with the bundle bone and the bone buccal bone should remain intact. This technique is being divided into the six types like the buccal shield. In the first we can see here, we can see the full C buccal, the half C buccal, the interproximal, the lingual or the palatal, and the multiple buccal shield. This classification is required so as to help the understanding of the preparation design. In this poster, we have discussed a case. Here we can see the frontal view where we can see the fractured right central incisor. This is the RVG of preoperative. This is an occlusal view of the case. Here we can see the vertical sectioning of the root which is being done with a long root resection burr. This is the palatal sectioning is being extracted. Here we can see the implant is being placing the implant. Here the implant is being placed. This photograph tells us the temporary crown with a screw retained. This is the post-operative photograph after 3 months with an emergence profile. This is the temporary restoration which is being placed over here, the temporary crown. This is the RVG which has been shoot 1 year post-operative with a zirconian abutment and a crown, and here we can see the crown placement or the crown cementation is done. This technique has certain indications like it is only done within healthy and the stable root where the buccal bone is intact with a positive gingival architecture and no fractures can be seen. There are some better contraindication of this technique like when the root is mobile, the presence of the pocket, negative gingival architecture, and infected root or the cracked tooth is present. There are some advantages of this technique like it protects the integrity of the bundle bone, it acts as a guidelines for implant positioning and preservation of the interdental papillae. With advantages, we have certain disadvantages or the limitations like this procedure is a technique sensitive procedure, the mobility of the shield and the root fragment might get displaced. Thank you.